Hi, I'm Laura Castle, and I'm the Director of Professional Affairs and Consultation at BostonSight. Today, I'm going to show you how to navigate your BostonSight SCLERAL FitKit. We have the 16 to 17 and 18 to 19 fit kits. Regardless of which kit you're using, it's the same methodology for selecting your first lens. When you open your fit kit, you'll notice that we have right and left lenses. This is important to know because of the built-in scleral torosity that we have in the haptics. The first step is to select your diameter. Once you have done that, select the standard deviation and place the lens on the eye. Once the lens is on the eye, assess through the slit lamp. If you notice a lot of movement greater than 1 millimeter, take that lens off and select the steep deviation. However, if you notice that standard lens is too tight and you notice impingement or blanching right away, go ahead and take that lens off and place the flat deviation lens on the eye. If you have a cornea that has a higher elevation and you need additional central sag beyond what is in the core set of lenses, we do have in each diameter a lens that has an additional 400 microns of central sag. We recommend the lens to settle on the eye for at least 30 minutes prior to the final assessment. After the lens is settled, perform an over-refraction. If the over-refraction provides the patient with their best visual acuity, you can proceed with ordering the lens through FitConnect. However, if the over-refraction does not provide optimal visual acuity for the patient, you can troubleshoot this with the additional eccentricity values found in your set. If the patient has a normal cornea or a low profile cornea, select FSC 0 from the fit kit. Apply the lens onto the eye and do an over-refraction. If this improves the patient's visual acuity, order through FitConnect. If the patient has a higher elevation or a highly ectatic cornea, you would select the FSC 2 lens from the fit kit. Apply this lens to the eye and do an over-refraction. If this improves the patient's visual acuity, order through FitConnect. It's important to note, if you're troubleshooting with the different eccentricity values, that this is just for refractive purposes only. If you have any questions or need assistance troubleshooting the fit, you can upload images and include notes for the consultation team within FitConnect.